Thanks, Kat, for the slides. Can you hear me okay, everyone?
Perfect.
Okay, that's great. So my name is Joe McArdle. I'm working with the West Mercia 5G project as one of the academic partners alongside University of Worcester as well. If we go to the next slide, I'm literally going to go give a high-level review. There's more slides on here than actually the ones I'll go through because there's some detail around some of the use cases, but I'm only going to do a really high-level presentation, recognizing the time limits we've got. So the project's similar to the ones we've had today. We talked about Spring, we've talked about the Connected Forest being part of the, for us as the Rural Connected Communities Testbed and Trials Programme. Really, we're looking to try and look at the infrastructure challenges in rural settings when planning and building a network, but then also how that network can enhance health and social care services, to try and look at really this private-public partnership to make a commercial and viable option for networks in these rural settings. If we go to the next slide. So our vision really around the project is specifically, looking at the deployment model. So we're looking at the technical bits of, can we repurpose existing infrastructure in a much more cost-effective way and allow scalability at pace for the adoption of 5G, as well as look at the real-world testing of some of the use cases that we have for the healthcare setting and how that aligns with some of the existing digital transformations working in healthcare at this moment in time, and the unique challenges that rural healthcare have maybe compared to those in significant urban areas. We were lucky, we're building on the foundations already of the West Mercia 5G piece of work, and we really are looking at how we can learn from associated test beds by building on the links with Liverpool 5G, connecting health and social care, but also looking at how we use the networks that DCMS themselves are generating, learning from Dorset as well and other areas. Next slide. As I said, we are a partnership between private, public and academia to really look at how this is scaled up. So these are the 9 partners that we've got working in that process. If we go to the next slide. So talking about the infrastructure, it is a small test bed. We're looking to build on the existing one at the moment for the starting of the work program we've got at the Malvern Hill Science Park, while the construction and the work with our mobile network providers in Tenbury Wells to look at the scope around that area. But it is important that because we're looking in health and social care settings, we really need to understand, we've talked earlier on about this, about the added value that 5G gives, because is the added value from the 5G or is the added value from the healthcare transformation? Does the 5G enable the acceleration of the healthcare transformation that we need? And certainly has been demonstrated so clearly as we've been in the pandemic. So the opportunity we've got with DCMS to really look at comparing the technologies and look at the real world results across those different settings and see what stories we can tell from that. If we go to the next slide. So in summary, a quick high level overview of the use cases. One, we're going to look at a mixed reality solution to look at supporting musculoskeletal services out of the hospital settings and out of clinical settings to try and address targeted exercises. And we're also going to look at how we can support the remote consultation in primary care between care home residents and practices, but also other services. And that's important because it doesn't just transform health, but it will reduce some of the other risks and the wider public health risks around accessibility to care and clinician time demands, reduction of journey times, reduction of acute care costs by the early intervention. So these are things that for us makes it more sustainable, makes it more viable for a public-private partnership to progress and embed a 5G network going forward. Now, the next set of slides, about 4 slides, which are really describing to us the how, the what, the why, and the where. I'm not going to go into those in details. They will be available in there, but it's just to give you a summary of those. If we could go to the next slide. So when we're looking at the extended reality approach, this one just describes the who we're working with talk out and really sets out the description of what we're looking at. If we go to the next slide. Here we talk about the why we're doing. We've got some real problems, and we have really be able to take forward telecommunication and telehealth consultation during the pandemic, but actually to use the high quality data streams that 5G can offer us around the visualization becomes really helpful to help the clinicians to make judgments. So if we go to the next slide. So this describes what we're trying to do. So if we go to the next slide, and this describes to us particularly, again, how we're trying to do this in that perspective. So again, in summary, we're going to try and use, on the next slide, I'll show you an image of what this looks like. If you could go to the next slide, and I'll talk through those previous slides. These will be available after the event and with the recording. But in essence, we're able to get an image, an avatar, that the clinician will be able to see and read alongside the existing life signs of individuals, but within their home setting. So rather than dragging them somewhere, and particularly musculoskeletal, it will be able to look at improvement, look at how those exercises are and what the optimum measure, so you can contrast and look and track history visually. So this is where we do see the 5G bandwidth and the 5G opportunities exist by using these mixed realities, learning from the other opportunities people have talked about around in engineering. When we look at some of the airline services, have been also using some of these mixed reality approaches. So we go to the next slide. Okay, so for us, the practical application is an MSK clinic. We can also help physiotherapists then to actually help deliver their clinical care by that remote engagement in a much more practical way. Also part of this will enable us to understand, by looking at matched populations in the 4G areas of Shropshire as well as the 5G testbed areas, what is the difference that the 5G offers? We know what the technical solutions, but in the adaptation and adoption of these technologies. So if we go to the next slide. So again, the second use case for us specifically is really focused on enhancing that existing telecommunication by using a headwear camera. So we can get data, and we talked about we are running this alongside existing programs for remote monitoring, but actually how can that be enhanced through the use of visual images and live narrative and discussions, both between the clinician or a supervisor to those individuals who are at the home or the residence of somebody out at a distance. We know in rural areas, very dispersed populations, these are real challenges. So we look at the next slide. When we look at the connected work, already we've seen there's several scenarios that we can use, and the one we're going to focus on particularly is enabling a GP to do their ward round or an urgent care visit in a care home without having to physically be there. And that's quite important because that can reduce the number of ambulance transfers for individuals, which might be the other way that people would go there. Although I said that we see other potential applications, both in training support and also in dom care. But for this particular use case for our testbed, we're going to start off with just the GP ward round and engage in those individuals. So we move to the next slide. So far, we started in the 1st of March, and there's been a lot of learning and some real technical challenges that we've had, as well as some project challenges. But all learning takes place from what works well and what doesn't work well and what becomes important. And for us specifically, it's already become important. The co-production with clinicians on the workflow, how this fits in with their workflow, etc., is really quite important. And how this aligns with existing digital transformations. We'd look at the remote monitoring program working across the West Midlands, across Warwickshire, and the 4 local authorities. So there's something about getting clinical ownership. We've already started to flag up around that bit. We know there have been challenges around getting access to practice and practice managers because of the COVID vaccination workload. So we really have to think about the narrative about the clinical hooks, similarly to care homes. What is the added value for them around this, and really want to demonstrate this quite early on. That is achieved by looking at our alignment with the existing digital transformation programs. So it's seen as something that works with and encourages the adoption of large scale change rather than against or specifically other initiatives going in the program. Otherwise, people just get exhausted from that. we're really looking, once the infrastructure is built, that we use for more local testbed utilization of that network, working with other partners into that. And by working with the Academic Health Science Network, that enables that much more open. But at the moment, our investment in effort is really focused on those two specific test cases. And then importantly for us, sharing our learning, but also sharing our challenges with the other test beds. And we have a quite close relationship with the Liverpool 5G, the Dorset 5G. I know Chris has been working also with Connected Forest, because some of the people engagement and people change processes are just as important as the technical build that we've changed on. So in summary, part of the question we're going to try to answer this isn't just about scaling up, but do we need 5G? And the answer at the moment is yes, we do, because it's created the opportunity, as we described before, to share the risk about public and private, try to test that and build the economic case for change, but also enable that case to make a difference to the population, to make it own, and that people change process that helps the population to see the value of 5G as well, rather than some of the myths and anxieties that earlier test beds found. Finally, that I'll be open to any questions really, but that was a very high level view of where we've been up to at the moment. Thank